Why a woman needs biopsy. Breast biopsy is done to check a problem seen on a mammogram, such as small calcium deposits in breast tissue, microcalcification, or a fluid-filled mass called cyst. To evaluate nipple problems, such as a bloody discharge from the nipple. A breast biopsy is a procedure to remove a sample of breast tissue for testing. The tissue sample is sent to a lab, where doctors who specialize in analyzing blood and body tissue, the pathologists examine the tissue sample and provide a diagnosis. The results of a breast biopsy can show whether the area in question is breast cancer or it's not cancerous. The pathology report from the breast biopsy can help your doctor determine whether you need additional surgery or other treatment. For many biopsies, you'll get an injection to numb the area of the breast to be biopsied. Types of breast biopsy procedures include fine needle aspiration biopsy. This is the simplest type of breast biopsy and may be used to evaluate a lump that can be felt during a clinical breast exam. For the procedure, you lie on a table. While studying the lump with one hand, your doctor uses the other hand to direct a very thin needle into the lump. The needle is attached to a syringe that can collect a sample of cells or fluid from the lump. Fine needle aspiration is a quick way to distinguish between a fluid-filled cyst and a solid mass. It may also help avoid a more invasive biopsy procedure. If, however, the mass is solid, you may need a procedure to collect a tissue sample. Core needle biopsy. This type of breast biopsy may be used to assess a breast lump that's visible on a mammogram or ultrasound or that your doctor feels during a clinical breast exam. A radiologist or surgeon uses a thin, hollow needle to remove tissue samples from the breast mass, most often using ultrasound as a guide. Several samples, each about the size of a grain of rice, are collected and analyzed. Depending on the location of the mass, other imaging techniques, such as a mammogram or MRI, may be used to guide the positioning of the needle to obtain the tissue sample. Stereotactic biopsy. This type of biopsy uses mammograms to pinpoint the location of suspicious areas within the breast. For this procedure, you generally lie face down on a padded biopsy table with one of your breasts positioned in a hole in the table. Or you may have the procedure in a seated position. You may need to remain in this position for 30 minutes to 1 hour. If you're lying face down for the procedure, the table will be raised once you're in a comfortable position. Your breast is firmly compressed between two plates while mammograms are taken to show the radiologist the exact location of the area for biopsy. The radiologist makes a small incision, about 1/4 inch long, about 6 millimeters, into the breast. He or she then inserts either a needle or a vacuum-powered probe and removes several samples of tissue. Ultrasound-guided core needle biopsy. This type of core needle biopsy involves ultrasound, an imaging method that uses high-frequency sound waves to produce precise images of structures within the body. During this procedure, you lie on your back or side on an ultrasound table. Holding the ultrasound device against the breast, the radiologist locates the mass, makes a small incision to insert the needle, and takes several core samples of tissue. It may be several days before the results of a breast biopsy are available. After the biopsy procedure, the breast tissue is sent to a lab, where a doctor who specializes in analyzing blood and body tissue, pathologist, examines the sample using a microscope and special procedures. The pathologist prepares a pathology report that is sent to your doctor, who will share the results with you. The pathology report includes details about the size and consistency of the tissue samples and the location of the biopsy site. The report describes whether cancer, non-cancerous changes, or precancerous cells were present.